help others, kind of offer a service to others, and I thought medicine would be the best path for me. And so when I was going through college and trying to decide what I was going to do, I chose to go to medical school. There were lots of things about conventional medicine that I didn't like. The practice I worked in was a large group. There were about 5 physicians, 3 nurse practitioners. We had about 50 staff, a big expensive building, and it was an insurance-based practice. And so there was this continuous pressure to see more patients. You got to see more patients, you got to see more patients. It was volume-based. And so I was seeing between 25 and 30 patients a day, which by the time phones were answered, paperwork was done, it left me with about 90 seconds per patient, you know, and which is, anybody who's been to the doctor recently, that's just not enough time to really get to the root problem of anything, or really spend enough time talking about what needs to be talked about, addressing their issues, answering their questions. And so that was probably the biggest frustration for me, was just the time factor. I had all these things that I wanted to share and things that I knew could make people better, but there was just no time. And the second most important thing, or I guess the second most frustrating thing, were there were all these problems that people had that I had sent to different specialists. They had lots of testing done, all their tests are normal, and they come back to my office, they still feel bad, they're on 7 different medications, all their tests have come back negative, and they just want answers. Why do I feel bad? What's my problem? And I didn't feel like I had the tools to be able to uncover the root cause of why they felt so bad. You know, we start with diet, with nutrition. You know, the surface area of the gut is just enormous, and you know, we kind of think of the gut as being part of us, but it's really not. You know, really, it's just kind of this hollow tube that goes from one end to the other, and all day long we put things into it, and so the surface area of your gut is just exposed to stuff all day long. You know, good stuff, bad stuff, and everything in between. And so that's the kind of the bottom of the pyramid. So we initially start with diet. What are you eating? What are you drinking? And kind of work our way up from there.